So, welcome to the Holistic Horse Conference. I'm Dr. Jeff Grognet, and my co-host.
I'm Joan Renquet, animal communicator.
Okay, and this time we're going to be introducing Dr. Angel, and it's Dr. Angelique Barbera. And she's a dedicated animal wellness expert with a lifelong passion in equine care and holistic healing. She holds a Bachelor of Science in Veterinary Science with a minor in equine science and also an MS in veterinary pathology and a doctorate in chiropractic. And she's a lifelong equestrian. And she's combined her academic expertise and personal experience to, in a sense, revolutionize animal care. She's the founder of Holistic Animal Studies, and she empowers practitioners and pet owners, horse owners worldwide through innovative science-based courses in holistic therapies, promoting animal health and well-being for animals of all kinds. So welcome, Angel.
Thank you so much. I'm really happy to be here.
Yeah. So your topic today is going to be animal neuromyofascial release technique. So we'll start off with the obvious question. What is it?
Yeah, so it's actually a technique that I developed, and it's similar to, I call it a body alignment technique, but it's kind of similar to chiropractic, but it's not really chiropractic. We do use a tool that's similar to what looks like a human chiropractic tool, but the biggest difference is with chiropractic, it's a very specific adjustment where you're trying to move a vertebra from one spot, like more or less if it's, shifted in a way that it shouldn't be, it's a very specific adjustment to move it back to where it should be. But with this, it's actually a lot different because we're not putting motion per se into that vertebra, but what we're doing is we're neurologically stimulating the area and then also doing a soft tissue release, which allows the animal's body to more or less reset itself, would be the very basic description of it. But it's a really cool technique. It works really well, and we get some really amazing results with it.
Neat. Yeah. And so with chiropractic, like you say, part of chiropractic is the ability to figure out where the problem is and then to
Yes.
fix that problem. Okay.
Yeah, so I mean, similar, like when we use the tool that I was describing, we can actually use it to see where there's problematic areas because the animal will have a what we call a pathological reflex. It's a little twitch in that area when it's a problematic area. So we can use the tool to diagnose where the problematic areas are, and then we can also use it to release those areas. So it definitely focuses a lot on like the fascia and the surrounding musculature and really addressing that to allow the body to kind of reset both neurologically and soft tissue wise.
So does I just am wondering, like, if somebody is kind of stuck in a pattern, does that then um relate to like how they might behave?
As far as a horse goes,
Yeah.
yeah, so yeah, um, definitely you can see behavioral issues. One of the interesting things is people will say, "Oh, well, I've had my horse worked on by chiropractors on a regular basis," so they're not expecting us to find anything when we use ANMR technique. But where we're looking more at a neurological level on the horse, we oftentimes will find patterns, like you're saying, where there's areas of reactivity that get missed during standard chiropractic or osteopathic adjustments. So it is pretty interesting because it will definitely affect the way the horse moves, behavior, if they're in pain, obviously that can make them cranky, but we end up finding stuff that gets missed. I actually just taught in the Netherlands recently. I had a whole group of equine osteopaths and they were amazed that we through ANMR were clearing out things that they weren't able to do with their osteopathic techniques.
Also it would just kind of create a stuckness with the muscle memory, wouldn't it?
Yeah, definitely. Yeah, you can definitely have that happen with chronic issues.
Yeah.
And so when you're doing that, well, first let's back up. What type of condition would tell us that this would be the appropriate treatment technique?
Yeah, so most horses can benefit from it. Because most horses, just being ridden, running around and playing, they oftentimes will kind of get themselves a little out of whack, either through an acute injury or just chronic, repetitive things. So a lot of times an owner will contact us because the horse is either, doing behavioral things that are not characteristic of it under saddle, like maybe they're not wanting to move forward. They might be pinning their ears back, trying to bite at you, or having difficulty picking up a particular lead, or just having trouble bending from one side to the other. So there's a lot of different things that can show that the horse is uncomfortable. And like I said, we can go in with this technique and definitely clear that up. But a lot of times it'll be one of these things where they'd say, well, we tried massage, we tried chiropractic, we tried some different things, and we're still not completely clearing up this issue.
Right. Does it take multiple quote visits like a chiropractor to do this?
Normally it depends. If it's a chronic issue, it usually does take at least a few visits to completely clear it out. But we do often see pretty good improvement after one session, even with a lot of chronic issues.
Yeah.
What would it help things like even ring bone or navicular or laminitis? Does it?
It can help. So anytime that we're just kind of improving range of motion, improving blood flow, lymph circulation, it will help with conditions like that. So, but when we have degeneration, like you're mentioning with ring bone, and we have, arthritis more or less going on in that joint, we can't reverse it with this, but what we can do is slow down that rate of further degeneration by getting them moving more correctly.
And is it almost like, are you using acupressure points or are you?
It's actually very similar, yeah. So the way that we use the tool, it is similar because it's a smaller tip on it. So one of the things that happens is it fires very quickly. It's a spring-loaded tool, so it's firing quicker than the horse can its muscles can react to it. So you're able to get this really quick impulse in there, which, like I said, can stimulate them neurologically and also help with that soft tissue release. But yeah, it is actually similar to acupressure as far as the way that the animal responds to it. And we can use it on specific acupressure points. And then I do also do some stuff with actually red light pens that we can stimulate acupressure points with that as well, or acupoints.
Yeah. So how does I call it the average session work, Angel, like going from start to finish?
Yeah, it's kind of similar to if you have a body worker come out doing massage or chiropractic. We will evaluate the horse, do a gait analysis, do some palpations, get a history on them. And then usually with this particular technique, we'll run the tool over them. So we'll start kind of up in the upper cervicals at C1, and we'll run it along the neck, we'll run it along the back, and then we'll do some different checks at the pelvis. We'll check the shoulders. So we check different locations and we see where there are issues present. And then we do the releases to release that. And normally, if it's not a super chronic issue, we'll see the release and the owners can see that it's very visible. If we're not getting that full release, like I mentioned, it's usually just because it's been going on for a while. So it takes a few sessions to see that where they're not having the reactivity anymore. But the owners will always kind of often be amazed that even if we don't get that full release that we want, the horse immediately has improved range of motion. They're feeling better. They're moving better. So yeah, it's pretty cool to see it.
Yeah. So what do you see as a release?
So the release, it can be a couple things. The main thing that we see is that they don't have what we call this pathological reflex anymore. So when we put motion into the area, we're not getting that twitch. But then the other things we can do is check range of motion, and we'll see an improved range of motion as well.
And do they do the typical relaxation, sort of like yawning and?
Oh yeah, they do typical releases. You can get big yawns, sighs, head dropping, things of that nature, the licking and chewing. So yeah, definitely get those normal releases.
Right. And what if, I kind of think that every horse who's moving this way with a rider on needs a little help, but how do you convince people to think, oh, my horse is fine?
Yeah, it's a matter of educating people. I mean, when the horse has an obvious issue and they're like, okay, my horse is bucking me off or it really doesn't want to do this or that, they're kind of more, inclined to reach out and try to find some help. But what people need to realize is a lot of horses are actually really stoic and they'll kind of hide certain things for a long time until it gets to the point where it's just way too uncomfortable for them to deal with. And we don't want to wait that long. You know, it's kind of like the tip of the iceberg. Like you don't want to wait, and there's obviously a lot more going on than what you're seeing. So I say, like just what you're saying, if somebody's sitting on a horse and they're riding it, that horse's back needs attention. So it's one of those things where it is really important to do maintenance sessions. And I'm a big proponent. Like I think all kinds of body work is amazing. So definitely get some kind of body work done on your horse on a regular basis. And if you want to incorporate ANMR, I think it's a great thing that you can utilize that's a little bit different than what a lot of people are using.
And I think one thing that a lot of people don't know much about is fascia. So why does this become so important?
Yeah, so for those that aren't really familiar with fascia, fascia is simply the lining that surrounds every muscle and organ and everything in our body, and it connects it all. So that's why a lot of times if somebody has an issue, you know, say on the shoulder, it can affect the hip because the fascia, once it's tight, it's going to affect other parts of the body and definitely affect the way you or your animal moves based on those restrictions in the fascia. So definitely, for those that want to look into a little bit more about fascia, it's a very fascinating subject. The way that everything is interconnected and how it actually even communicates with each other.
Yeah. Yeah, it's been the big revelation in the last couple of years, and it explains acupuncture and all that stuff, right? So
Yeah, when you're thinking of like meridians and energy pathways, yeah, it's all along the fascia.
yeah. So you can combine your ANMR with other techniques, correct, Angel?
You can, yes. So you can use it in conjunction, you know, at the same time as a massage session. You can use it with acupuncture, acupressure, chiropractic, osteopathy. A lot of people do like magna wave, things of that nature. You can do it together in the same session. I also teach craniosacral therapy, which pairs well with it, things of that nature.
Uh, yeah, I have a million questions, but what would like your like learning from you, like if you were to say come to a little farm out here in California, what would
Which I would love to come visit you. So yeah, definitely hopefully we can get that set up.
Yeah.
But so I have a couple different workshops that I do. One would be geared towards horse owners. So if you're a horse owner and you just want to come and learn a little bit more about how body work can, you know, how your horse can benefit from it, we'll go over that. I'll teach you some basic stuff that you can do at home. It's not really going to replace the professional, but it gives you stuff that you can do in between sessions, and it definitely helps you bond with your horse and learn how to pick up on, you know, if they're having any kind of pain or anything like that going on. And definitely gives you a lot of tools that you can use at home to help them. Now, if you are a professional or you want to be a professional, then I have workshops that are geared towards people that want to add these techniques to their practice, or if they're working through the courses, because a lot of our coursework is online and they want hands-on guidance, they can come to a workshop and we'll run through everything with them in person.
Yeah.
And then maybe tell people what cranial sacral work is, because I think that's a lot of people hear about it and they think they know, but they would love.
Yeah, so craniosacral therapy is pretty cool. It works with the cerebral spinal fluid, which basically flows from the brain all the way down the spinal cord. So you can basically, what happens is a lot of times when an animal or a person has an injury of some sort, it can impact the flow of that fluid. And there's also a rhythm associated with it, so it can impact the rhythm. So it's kind of similar if you think of like our heartbeat or our breaths. There's a rhythm to the cranial sacral or the flow of that fluid through the system. So you can kind of tune into that. You can see if there's areas where it's restricted, it's not flowing correctly. And then through certain protocols where you hold your hands, things that you're doing, you can improve the flow of that. We do also often see a lot of like emotional stuff tied into craniosacral issues. So a lot of times if you have like a horse that had some kind of injury that was traumatic for it, like emotionally traumatic, they'll hold on to that. And during the craniosacral session, they can actually start to get kind of panicky or even a little bit aggressive as they're releasing it, and then they release it and they let it go. So it's a pretty interesting technique, which I think all animals can benefit from it, but
Yeah.
especially if you have an animal that's kind of had some traumatic past or some injury that they're kind of holding on to, or some abuse, something like that, it can help a lot to help them release that.
Yeah, I think it's one of the most amazing things. So do you teach that for like the average person, or do you teach that?
For professionals, yeah.
Yeah.
Yeah, that would be a professional course. For horse owners, currently we have a massage course, we have acupressure, we have aromatherapy. I teach a Reiki course as well that pet owners can enroll in. And we have a cold laser therapy course for pet owners as well. But the majority, like the ANMR, you have to be a professional to enroll. Or if you want to be an animal body worker, you can take our massage certification course first, and then that will qualify you to take the ANMR course and the craniosacral therapy.
Okay. Yeah. So, do you have to learn this is the textbook stuff? Do you have to learn a lot of anatomy for all those courses?
You do, yeah. So that's why we say you have to take the massage course first if you're not some kind of animal professional, because that will give you all of the background in the anatomy and physiology. And also, we want to make sure that you can safely handle animals and read their body language. So we cover all of that in the massage course, which is really comprehensive. So once you have that down, I know you're good to go on the other techniques, but we need to make sure you have the foundation down first.
Right. Yeah. No, I mean, there's so much involved in that. Well, you got the same thing. You got your chiropractic ticket
Mhm.
first, so to speak, right? And that
I
probably
actually I did the chiropractic after, yeah. So
Oh, you got it after.
I
Okay.
started off in the animal world and then decided to go to chiropractic school, which a lot of people probably don't know this, but chiropractic school is just for people. They don't really have, I mean, they
Right.
have programs that are specific to animals, but that's kind of a thing that you do extracurriculum wise. So I went from animals to people and then decided I liked animals best and went back to animals.
Yeah, how did you end up like learn, picking this path and then creating a path for others?
Yeah, so originally, I mean, I've always loved animals, so I knew I wanted to work with them. And as he mentioned, I have a master's degree in veterinary pathobiology, so I worked with animal diseases. And I ended up working a lot with drug companies, and I just kind of that wasn't the path I wanted to go down. I didn't really like their motivation, and they were very profit driven. I didn't really see that they were trying to help the animals that much. And I also had some stuff going on with a personal horse of mine that had developed laminitis. So I was trying to find some solutions for her. And that's when I just kind of really became more holistic oriented in the way that I wanted to handle her care, which ultimately led me down the road to deciding to pursue chiropractic and kind of going more into the holistic stuff. And then while in chiropractic school, I was learning all this great stuff. And I'm like, well, how can I apply this to animals? So I started kind of modifying techniques, doing things on animals. My, students that were in the program with me were like, "Oh, can you come look at my dog, or can you see what's going on with this or that?" So it just kind of went from there to developing my own courses and techniques, and then finally putting it online and making it available to a wide range of individuals.
Neat.
And
So,
do you have students all over? I mean, you're only one person, so to be able to get this out there, how does
Yeah, well,
it work?
so I have students in over 30 countries, but I also have a great team of teaching assistants, and I do some course collaborators that we've worked with in the past few years. We've kind of opened up to doing some collaborations with other professionals. So I do have people throughout the US. We have a good amount of people in Canada that are, co-instructors or teaching assistants for us. And then I have some people in Australia, but definitely student-wise, students all over the place.
yeah, I know you got lots of fingers out there. I know that.
Yeah.
Yeah,
You're doing great. Just doing great. So with the ANMR, do you want to give us like a case example or two on how
yeah,
you work this and what happens?
Yeah, so some common issues. I mean, a lot of horses will end up being reactive, like in their necks or in their backs somewhere. But a lot of times people will just reach out and say, you know, I have a horse that isn't bending well to the right, or they're, you know, pinning their ears back and acting like it's painful, or even sometimes the owners will try to check their range of motion. A lot of times they'll it either just bending them under saddle, like asking them to bend, or using a treat to see if they can, you know, turn their neck and bend and eat the treat. And oftentimes the owners will notice this restriction that their animals are not able to bend. And sometimes some owners are actually more in tune with their horses, and they can tell just from like brushing them and saddling them if a horse is really sore in a particular area. But a lot of times it'll be one of those issues where they're noticing something while they're riding, or they're noticing a pain issue just when they're interacting with the horse. And I will come out and, like I said, evaluate the horse, perform the technique, which I could probably get you guys a video of it. I don't know if you can get it in there or not, but I can show you what it looks like.
Cool.
Yeah. But so, and then we'll see, you know, the reactions decrease as far as the reactivity, that little twitch goes. And then I'll have the owners usually, we'll give them a little bit of time for their bodies to process it, like a day or so, and then I'll have them work them again and see how they're moving, and get back to me with feedback. And it's always positive. I mean, especially if it's the first time that they've had it, the owners are usually really amazed by
I
how
bet.
much they've improved. And then they get a little disappointed after like the second or third one, because they're like, the improvement wasn't as big. I'm like, well, that's because they improved so much after the first one. But they definitely, I do encourage people though to keep up with the sessions, because a lot of times people will say, oh, well, they look so good after this one, they don't want to continue and do more of them. But it is important for the horse that we completely clear that out before we put them kind of more on a maintenance schedule, which will depend on what the horse is doing. If it's a competitive horse that's being worked and ridden all the time, usually once a month to once every 3 months, depending on what the horse has going on, is a pretty good just maintenance schedule. But if they have some kind of injury or something that happened, they might need it more often than that.
Yeah. Neat. And so the procedure that when you arrive on the farm is what? You watch the horse moving first and figure out
Yeah, I
what
like to
could be
watch them,
happening.
depending on what's going on. Usually it could sometimes just be the owner like walking the horse up to me. I'll kind of watch their gait. If it's a specific issue, I could have them either lunge or round pin the horse, or just you know, trot them back and forth like a normal lameness exam. See what's going on with them that way. I like to look at their posture to see if they're compensating just when they're standing, and then get my hands on them, see if I can note any kind of swelling, heat, painful areas. Most horses, if they're painful, they'll either kind of move away from you as you touch that area, or they might pin their ears back or kind of switch their tail. So look at their body language to see what might be going on there, looking for any kind of asymmetry, if they have a muscle that's kind of more built up on one side versus the other side. And then using the tool to look for those little twitches along the spine, and then doing the protocol to release what we find. If there are areas that are really problematic, or I find some inflammation, I like to follow up with like either some kinesiology tape we can put on them following the session. We could do some cold laser therapy, things of that nature, which can just complement that and kind of help them handle that inflammation and decrease the pain.
Yeah. So multimodal approach is what you're doing.
Mhm.
Yeah.
Oh, definitely. Yeah.
Yeah.
So I usually incorporate several different techniques when I go to an appointment. So just it's kind of based on what the horse needs. And I like to price it in such a way that I just have one fee to come out, and that includes whatever I end up, you know, throwing in for that horse. I found it's easier that way than trying to say, well, now you owe me extra because I put tape on it.
Right.
I just have one fee and it's whatever they need. If I do cranial psychotherapy, if I tape them, if I cold laser them, if, you know, whatever it needs to get done.
Yeah. Yeah.
And
And
you seem to travel quite a bit. Are you like mostly in Florida, or are you all over the map?
Well, I'm based in Florida, so I do live in Florida, but I do travel a lot, and it's mostly teaching. I will sometimes I'll work on animals sometimes when I'm there, but it's mostly in a teaching capacity. But yeah, I just got back from Asia and Dubai and Europe, and have some more stuff coming up. I'm going to be in Arizona in February doing some workshops, and then I'll be in California in April, and then actually heading back over to Asia. Then next year going to Australia and New Zealand in November, which I'm really looking forward to because I have not been over there yet.
Yeah, that's awesome. Me neither.
Yeah, yeah. That's well, that way you're spreading your word out wonderfully. So,
Oh, well, thank you. Yeah,
that's
we're actually
exciting.
coming up on the 10-year anniversary of putting the courses online, so that'll be in January. So yeah, I can't believe a decade's gone by already.
Yeah, yeah. The
And
time goes by real fast.
yeah, and when you talk about like your online courses, are those things that people could just like I could go down and do something on one of my horses here after I watch a course?
Yeah, yeah. So it depends on which technique you're looking at and if it's a certification course versus a non-certification course. Our non-certification courses are geared more for horse owners that want to learn how to do it for their own horses, whereas the certification ones are for people that want to either add that to their practice or start a practice as an animal body worker. But yeah, they're very comprehensive. So if it's a certification course, you will have to do case studies, submit videos, take exams, things of that nature, get hands-on practice hours. So we make sure that you know what you're doing before you go out and do it. And we have some great TAs that give you feedback if you need to set up like Zoom meetings, phone calls, anything of that nature. And then also, as we mentioned, you can always come to Florida and do a workshop with me. Or if I'm traveling in, your location, you can set that up too if you want that extra guidance. But we have students all over the world and they complete these courses without doing, with the in-person stuff with me, and they do an amazing job. I get feedback all the time. I see the animals that they're helping, and they definitely, it's possible to learn it online. It's, easy to go out and help these animals once you go through the coursework and are efficient in the techniques, and it's definitely it's pretty cool seeing what they do.
You know what? I have to say, can we take a second? Jeff, my dog is letting me know that she needs to, all right, she was
There we go. We're back again. Okay. So
I
we
have,
you
I have a
probably have another question, right?
mhm.
Okay.
Uh,
Let's do
what
that.
you have also a sanctuary. Do you work on other animals other than horses?
Yeah, so pretty much any animal with a spine
Hmm.
can benefit from it. But yeah, so at the sanctuary we have a lot of different animals. We have goats and sheep and pigs and an assortment of different birds. We do have dogs and cats too. When I first started it, I got kind of into the hospice dogs and cats, which was rewarding, but also a lot of work. And then it was really sad because they all started dying at the same time.
Yeah,
So it kind of got away from doing too much of that, but we do still have dogs and cats as part of the sanctuary. But mostly farm animals is what we take in now. So we have horses as well, cattle, sheep, goats, pigs, a little bit of everything.
that's awesome.
Neat.
Yeah.
Okay. So we've talked about a lot. So you've got if people want to sort of get a bit of an introduction to this and see what you're teaching, you've got a course for them, Angel?
Yeah, so if they're professionals and they want to learn how to do ANMR, we have the course for that. If they just kind of want to get into if they're horse owners and they want to learn how to, see if their animals are in pain or if they want to just kind of learn what they can do body work wise for their horses, we have a free course that they can actually sign up for, which teaches you, it goes through basically evaluating your horse, looking at a gait analysis to see if there's any kind of issues with lameness or issues with the gait, palpating your horse, signs of any kind of pain or discomfort. And that's a free course that we put out there just so, because I know a lot of people, they just don't know. So
Right.
that teaches them how to recognize if the horse is in pain. And we have a similar one for dogs too, for those that want to learn about their dogs. And then they can kind of go from there if they want to learn how to do massage techniques, if they want to learn how to do cold laser therapy, kinesiology taping. We have a ton of different courses, so that's something that they can definitely look into. And we're always here, like whether it's me or one of my teaching assistants or our program admin, if they have questions, they can reach out to us and say, hey, I have a horse or a dog that is doing this or that. What would you recommend I learn to help them? And we'll definitely give them suggestions on that.
Hmm.
Yeah, I mean, that's so great because being having a little tool to assess a situation, because we all look at our animals every day and we don't see, it's like we don't see that they've dropped so much weight, or that we don't see that they've gained so much weight, or that they're walking funny, because we're looking at them every day.
Yeah.
Yeah, it definitely can be, I think, difficult for some owners to recognize things and pick up on it. But I always tell people too, try to just become really familiar with your animal, and if you notice little things that are off with them, look into it because oftentimes you got to trust your intuition when it comes to that.
Yeah.
Mhm.
Yeah. The mistakes a lot of people make, and this is horses, dogs, especially cats. Well, I don't see them limping.
Yeah.
Mm.
Or with dogs, they're not crying. Oh God. I mean, if you got
Oh
a
my
dog
God.
that's crying, you're in big caca. But the
Yeah.
point
Yeah.
is, horses, they compensate, they do things, and that's the key. You've got to look for what they're doing.
Hmm.
Away rather than seeing them, oh, I've got a dog, or I've got a horse that's limping on his left front leg. I mean,
Right. But like, are they
that
right?
that means they've probably broken it.
Yeah.
Yeah, once they're limping, it's pretty bad. But yeah, a lot of people will actually mistake signs of pain for behavioral issues. They'll be
Yeah.
like, "Oh, my horse is biting at me," or doesn't want to be saddled, or doesn't want to move forward when I try to push him forward when we're riding. So they'll think that the horse is just being stubborn, or he's like, not wanting to do it. But what they don't understand is that there's a pain element that's causing that. So you definitely need to look into that and find out why the horse is reacting that way.
Yeah.
That I teach an animal medical intuition class, because if you look at who that animal is, half the time they're a pleaser, or they're this, so they're not going to say no to it. There's
Mhm.
really a definite reason for it.
Yeah, especially a lot of horses. Like I said, a lot of them are stoic, and especially if they've undergone like rigorous training, it's kind of drilled into them that this is my job and this is what I do. And unless they're to the point where they're like ready to fall over, they're going to try to do it for you. So
Yeah.
you really need to kind of be familiar with, little signs of discomfort for them.
Yeah. Well, thank you for bringing all this up, Angel.
Yeah.
It's been
Yeah, no, thank you guys. Thank you for having me. I really appreciate it.
Yeah, no, it's been great. So thank you. And if anyone wants to get that free course, definitely the link is below the webinar. Sign up for it, and you'll be able to see what Angel can teach you, and it'll help. That's the whole idea. You can
Yeah.
take better care of your beastie.
Hmm.
Okay. So
Yes, definitely.
so keep working, and we'll catch you in the next webinar.